Welcome to today's video. Let me ask you a serious question. What if your body is warning you about heart failure right now, and you're ignoring it? Not because you don't care, but because the signs feel normal, like aging, like stress, like being out of shape. Here's the reality. More than 6 million Americans are currently living with heart failure, and most of them didn't recognize the early warning signs until the condition had already progressed. Medical research reveals something shocking. Most people dismiss early heart failure symptoms for months, sometimes years. Why? Because the heart doesn't fail loudly at first. It whispers. And today, your heart might be whispering to you. In this video, we'll uncover 13 early warning signs of heart failure that most people completely overlook. Some will surprise you, like why you suddenly struggle to breathe when bending over to tie your shoes, or why you're waking up at night needing more pillows just to sleep. By the end of this video, you'll know what symptoms matter, which ones are dangerous, and when to seek medical help before it's too late. This video is for educational purposes only and is not a substitute for professional medical advice. All information is based on verified medical research. References are linked in the description. Now, let's begin.
Sign 1. Shortness of breath during simple activities. It often starts quietly. One day, the stairs feel a little harder. Another day, carrying groceries leaves you unusually tired. You tell yourself, I'm just getting older. Most people do. But this kind of shortness of breath isn't normal aging. It's not about running or lifting something heavy. It's about feeling breathless during simple, everyday moments. Walking to the mailbox, climbing one flight of stairs, standing up and moving across a room. The American Heart Association warns that this type of breathlessness is one of the earliest and most common signs of heart failure. Here's why. When your heart weakens, it can't pump blood as effectively as it used to. Your muscles don't get the oxygen they need, so your lungs step in and try to compensate. You breathe faster, your chest feels tight, and suddenly your body feels heavier than it should. This isn't just being tired. The difference is progression. Tasks that were easy last year become difficult. Activities you never thought about now require pauses and rest. And slowly, without realizing it, you start adjusting your life around the breathlessness. If you're stopping during routine activities, if you feel winded doing things that once felt effortless, your heart may be asking for help. Listening early can protect not just your health, but your independence.
Sign number 2. Orthopnea, needing more pillows to sleep. It usually starts as a small change. One night, you add an extra pillow. You tell yourself it's just more comfortable. Weeks pass, then months. Soon, one pillow isn't enough anymore. Needing to sleep propped up to breathe comfortably has a name, orthopnea, and it's one of the most common warning signs of heart failure. Here's why it happens. When you lie flat, blood flows back toward your chest more easily. A healthy heart handles this without trouble, but a weakened heart can't keep up. Blood backs up into the lungs, fluid seeps into lung tissue. Breathing feels heavy, air feels harder to pull in. So you adapt. You stack pillows, you sleep half sitting. Some people eventually move to a recliner, not realizing why. Research shows nearly 8 out of 10 heart failure patients experience orthopnea. Yet many dismiss it as aging or a sleeping habit. But this isn't a preference. It's your lungs asking for help because your heart is under strain. If breathing improves only when you're upright, if lying flat makes sleep uncomfortable, this is not just about pillows. It's about your heart. Sign number 3. Paroxysmal nocturnal dyspnea. Imagine this scenario. You're asleep, deep into the night. Suddenly, you wake up gasping for air. Your heart is pounding. Your chest feels tight. A wave of panic rushes over you. You sit up. You swing your legs over the bed.
You may even stand because lying down feels unbearable. This frightening experience has a medical name, paroxysmal nocturnal dyspnea, or PND. It typically occurs 2 to 4 hours after falling asleep. Here's what's happening inside your body. During the day, fluid naturally pools in your legs due to gravity. When you lie down for several hours, that fluid redistributes back into your bloodstream. In a healthy heart, this extra fluid is managed without issue, but a weakened heart struggles. The sudden increase in blood volume overwhelms the heart's pumping ability. Pressure builds, fluid leaks into the lungs. As the lungs fill with fluid, breathing becomes difficult, sometimes suddenly and severely. That's why you wake up gasping. Sitting upright allows gravity to pull fluid away from the lungs, easing breathing. Many people misunderstand these episodes. They assume it's anxiety, a bad dream, or even sleep apnea. But recurrent episodes of waking up breathless are a serious medical warning sign. Paroxysmal nocturnal dyspnea is strongly associated with heart failure and should never be ignored. If this happens repeatedly, your heart may be signaling that it's under dangerous strain. Sign number 4. Extreme fatigue and reduced stamina. This is not ordinary tiredness. This is a deep, persistent exhaustion that doesn't go away, even after rest. When the heart can no longer pump blood efficiently, the body is forced to make difficult choices. Blood flow is prioritized to organs essential for survival, the brain and the heart itself. To make that happen, circulation to the muscles is reduced. The result is widespread fatigue. Your limbs feel heavy. Movement feels harder than it should. Endurance drops dramatically. You may notice longer recovery times after simple activities. Climbing stairs feels unusually difficult. Even showering can leave you drained. This doesn't happen overnight. The decline is gradual. People slowly adjust their routines. They move more slowly. They take more breaks. They avoid activities that once felt easy. Because the change happens step by step, many assume it's just aging. But normal aging does not cause a progressive loss of basic stamina. When everyday tasks consistently leave you exhausted, it may be a sign that your heart is struggling to supply your body with enough oxygen-rich blood. Recognizing this early can prevent further decline and protect your quality of life. Sign number 5. Ankle, foot, or leg swelling. Persistent swelling in the lower extremities is a hallmark sign of heart failure. This condition is called peripheral edema. It is not transient swelling. Characteristics include worsening throughout the day, bilateral involvement of both legs, and pitting edema, where pressure leaves a visible indentation. The mechanism is straightforward. A weakened heart cannot pump blood forward effectively. Blood accumulates in the lower extremities due to gravity. At the same time, reduced kidney perfusion triggers salt and water retention. This further increases fluid volume. The combined effect leads to progressive swelling of the ankles, feet, and legs. Clinical data indicate that approximately 70% of heart failure patients present with lower extremity edema at diagnosis. Despite this, the symptom is frequently dismissed. Heat exposure, prolonged standing, or aging are often blamed. However, persistent bilateral leg swelling is not normal and should prompt medical evaluation. When the body visibly retains fluid, the heart may be failing to keep up with circulatory demands. Early recognition allows intervention before complications escalate. Sign number 6. Rapid weight gain that doesn't make sense. One morning, the scale is higher than usual. You shrug it off. A few days later, it's higher again. You haven't changed how you eat. You haven't stopped moving, yet your weight keeps climbing. This kind of weight gain isn't about calories. It's about fluid. When the heart weakens, the kidneys don't get enough blood flow. They think the body is running low. so they hold on to salt and water. Fluid builds quietly, day by day. You may feel bloated, your clothes may feel snug, your body may feel heavier than it should. Some people gain several pounds in a single week without realizing why. In heart failure, this isn't uncommon. That extra weight is fluid collecting in tissues, lungs, and even around organs. Many people blame themselves. They think they've done something wrong. But this isn't a willpower issue. It's a circulation problem. Unexplained, rapid weight gain is your body signaling that fluid is backing up and your heart is struggling to keep up. Sign number 7. Frequent nighttime urination. It starts quietly. You wake up once at night to use the bathroom, then twice, then 3 or 4 times. At first, you don't think much of it. You assume it's age, or something you drank, or just part of getting older. But this pattern has a name, nocturia. And in heart failure, it's often one of the earliest warning signs. During the day, fluid collects in your legs. Your body holds onto it because your heart can't move it efficiently. At night, when you lie flat, that fluid returns to your bloodstream. The kidneys suddenly receive more fluid than they can comfortably handle, so they release it through urine. That's why nighttime trips become frequent and why the volume is often larger than expected. Many patients report waking up 3 or 4 times every night. This can happen even before shortness of breath or visible swelling appears. Because it doesn't feel dramatic, it's easy to overlook. But when your sleep is repeatedly interrupted by the need to urinate, your heart may already be struggling with fluid balance. Sometimes the quiet signs come first. Sign 8. Nighttime cough or wheezing. A persistent cough that appears mainly at night, worsens when lying flat, improves when sitting up. This happens when fluid mildly accumulates in the lungs. Some people cough up white, pink-tinged, or frothy mucus. This symptom is frequently mistaken for allergies or postnasal drip, but it can signal heart failure. Sign 9. Loss of appetite and gastrointestinal symptoms. Loss of appetite and nausea are recognized symptoms of heart failure. These symptoms result from reduced blood flow to the gastrointestinal system and fluid congestion in abdominal organs. As cardiac output declines, circulation is prioritized to essential organs. The digestive tract receives less perfusion. Additionally, venous congestion can cause swelling of the liver and intestines. This leads to early satiety, abdominal discomfort, bloating, and nausea. Patients may report eating smaller portions or avoiding meals altogether. Unintentional weight loss can occur. Because these symptoms are nonspecific, they are often attributed to aging or gastrointestinal conditions. However, persistent appetite changes in the context of other symptoms should raise concern for heart failure. Reduced appetite reflects systemic circulatory compromise and should prompt further evaluation.
Sign 10. When dizziness interrupts your day. It might start as a brief moment. You stand up too quickly and feel the room spin. A wave of lightheadedness hits. You catch yourself on a wall. You sit down, shaken. This isn't just tiredness or dehydration. It's your heart telling you it's struggling. When the heart can't pump blood effectively, your brain may not get the steady supply it needs. Simple actions, standing, moving suddenly, or physical activity can cause your blood pressure to drop. Nearly 1 in 5 people with heart failure experience fainting or near fainting. These episodes can be frightening. They interrupt your life and signal that your heart's output is too low. If you experience dizziness or feel like you might faint, especially often, it's important to get checked. Your heart needs support.
Sign 11. When thinking doesn't feel as clear as it used to. You lose your train of thought mid-sentence. You forget why you walked into a room. Conversations feel harder to follow. At first, you brush it off. Everyone forgets things sometimes. But when mental fog becomes frequent, something deeper may be happening. In heart failure, the brain may not be getting the steady blood flow it needs. Even small reductions in oxygen delivery can affect focus, memory, and clarity. You may feel slower, less sharp, easily overwhelmed. This can be frightening, especially when it happens quietly. Many people blame stress or age, but when cognitive changes appear alongside fatigue, breathlessness, or swelling, they may be connected. Your heart fuels your brain. When that fuel supply weakens, the mind feels it. Confusion is not always dramatic. Sometimes it's just the feeling that something isn't quite right, and that feeling deserves attention.
Sign number 12. When bending makes breathing hard. You bend down to tie your shoes or pick something up. Within seconds, your chest tightens. You feel short of breath. You pause, breathing faster. This symptom has a name, bendopnea. It was only identified recently, in 2014. Bendopnea is a clear signal your heart is under pressure. When you bend forward, blood flows differently inside your chest. If your heart is weak, it can't keep up with this change. The result is breathlessness, quick and specific. If you experience this, it's not normal. It means your heart may be struggling in ways you didn't expect. Recognizing bendopnea early can help you get the treatment you need.
Sign number 13, when your hands and feet feel cold all the time. Have you noticed your hands or feet feeling cold, even inside? Maybe they look pale or even slightly blue. They take longer than usual to warm up, no matter how many socks or gloves you wear. This isn't just about the weather. When your heart isn't pumping well, your body protects the most important organs first. Blood flow is sent to the brain and heart at the expense of your hands and feet. At the same time, doctors watch something called your pulse pressure, the difference between the top and bottom numbers in your blood pressure reading. When that gap gets smaller, it often means your heart isn't pumping strongly. Cold hands and feet combined with a narrow pulse pressure can be an early sign your circulation is struggling. It's your body's way of telling you it needs help.
If any of these signs felt familiar, take a deep breath, but don't ignore what your body is telling you. Heart failure isn't a life sentence. When caught early, it's a condition you can manage and even overcome. The real risk? Letting these warning signs slip by unnoticed. The good news is that today's medical advances give you powerful tools to strengthen your heart, ease your symptoms, and add meaningful years to your life. Your heart deserves the attention, care, and action. If this video made a difference for you, type helpful in the comments below. Your support inspires us to keep sharing life-saving information. Don't forget to like, share, and subscribe for more trusted health tips. Thank you for stepping up and taking charge of your heart health. Your journey to a stronger heart starts now.